structure of the internal structure of the medulla oblongata, I will draw three cross sections of the medulla oblongata. First one is in the inferior part, near to the spinal cord. In the inferior part, near to the spinal cord, cross section of the medulla oblongata is similar to this. Okay? Similar to the anterior cross section of the spinal cord. Yeah. You see this cross section and gray matter of the medulla oblongata makes this matter. Okay? In this area, in the anterior part of the medulla oblongata here, there are descending fibers. Yeah? These descending fibers are corticospinal tract or pyramidal tract. Okay? These are corticospinal tract on the right side, and these are corticospinal tract fibers on the left side. Is it clear?
Yes.
Corticospinal tract is sensory or motor.
Motor is.
Yeah?
Yes.
From cortex descend to the spinal cord. In this section, in the inferior part of the medulla oblongata, 75% to 80% of left side fibers go to the right side. Okay? And 75 to 80% of fibers on the right side go to the left side and make crossing. Okay? This crossing is the causation of the pyramids or pyramidal decussation. Okay? You see here, anterior median fissure is filled by these crossing fibers. Is it clear? You see here. And in this section, gray matter of the medulla oblongata that is similar to the gray matter of the spinal cord divides to two parts. Posterior large part and anterior small part. This section is at the level of pyramidal decussation. Okay?
Okay.
At the level of pyramidal decussation in the inferior part of the medulla oblongata. If I draw a section from superior part of the closed compartment of the medulla oblongata. You see this structure. Medulla oblongata will be larger, and gray matter of the medulla oblongata has two large nuclei, nucleus gracilis and nucleus conatus. Okay?
Okay.
In this section, in the superior part of the closed part, you see nucleus gracilis, nucleus conatus, and spinal nucleus of the trigeminal nerve. Spinal nucleus of the trigeminal nerve. This is nucleus gracilis, this is nucleus conatus, and this one is the spinal nucleus of the trigeminal nerve. Spinal nucleus of trigeminal nerve. Okay? Is it clear?
Yes.
In this part, anterior part, which fibers descend? Here is pyramid or pyramids. Under pyramid or pyramids there are corticospinal tract or pyramidal tract fibers. Yeah? Yeah?
Yes.
These fibers descend, and in this area, in the inferior part of the medulla oblongata, make the cassation. This is before the cassation. Here is corticospinal tract. Yeah? This tract. Corticospinal tract. Corticospinal tract is motor. Yeah? Is motor. Is it clear?
Yes.
Yeah? This is corticospinal tract, motor. When I tell you this is gracilis nucleus, you told me gracilis nucleus is a collection of cell body of neurons for a specific function. Yeah? Neurons of gracilis nucleus here. These neurons go anteriorly and then turn to the opposite side here. These fibers make internal arcuate fibers. Internal arcuate fibers. Okay? These are internal arcuate fibers. From gracilis nucleus to the opposite side of the medulla oblongata. These fibers make internal arcuate fibers. Is it clear?
Yes.
Okay. nucleus, there are many fibers that these fibers make internal arcuate fibers similar to the gracilis fibers. If you remember, I told you conatus fasciculus is related to the upper limb, and gracilis fasciculus is related to the lower limb. Yeah? Internal arcuate fibers of the conatus are located posterior to the internal arcuate fibers of the gracilis. Okay? This is for discriminative touch and vibration of lower limb and upper limb. Yeah? You see here, lower limb is anterior to the upper limb. These fibers, these internal arcuate fibers on the opposite side make a tract that is called medial lemniscus, ML. Medial lemniscus. In the Farsi, we tell نوار ریل داخلی. نوار ریل داخلی. نوار ریل داخلی. medial lemniscus. Okay? Internal arcuate fibers of the left side go to the right side and make medial lemniscus on the right side. Internal arcuate fibers from right side go to the left side. And here is the cassation of medial lemnisci. Here is the cassation of medial lemnisci. The superior part of the closed part of the medulla oblongata. There is the cassation of medial lemnisci. Is it clear?
Yes.
Okay. On the superior part, on the open part, I can draw two cross sections. In the inferior part of the closed open part and superior part of the open part. Okay? Open part makes floor of the fourth ventricle. Yeah? You know. Here is fourth ventricle, median sulcus, sulcus limitans, okay? This is floor of the fourth ventricle. And anterior surface of the fourth ventricle, anterior surface of the open part has two elevations that are called pyramids or pyramids. Yeah? Here is anterolateral sulcus and olive, and here is inferior cerebellar peduncle. Here is inferior cerebellar peduncle. On each side of the midline, in the open part, from anterior to posterior, there are these structures. M is corticospinal tract or pyramidal tract. Yeah?
Yes.
ML, medial lemniscus. ML, medial lemniscus. Posterior to the medial lemniscus, there is tectospinal tract, TS. And posterior to the tectospinal tract, there is MLF. MLF. Medial longitudinal fasciculus. Medial longitudinal fasciculus from anterior to the posterior. MLTS, MLF. MLTS, MLF. Okay? M is corticospinal tract. M is corticospinal tract. ML is medial lemniscus. TS is tectospinal tract. And MLF is medial longitudinal fasciculus. Medial longitudinal fasciculus makes connection between cranial nerves. Connection of cranial nerves. When I'm looking to the left side, okay, see my eyes. In this movement of eye, my left eye goes to the left side. Okay? By contraction of lateral rectus muscle. Innervation of the lateral rectus muscle is by abducens nerve, cranial nerve number 6. And my right eye goes to the left side by contraction of the medial rectus muscle. Innervation of medial rectus muscle is by oculomotor nerve. Oculomotor nerve is cranial nerve number 3. Okay? For this movement, I need collaboration of cranial number 3 on the left side, right side with cranial nerve number 6 on the left side. Hassan, go out. Go out. Go. We need contribution of 2 cranial nerves together. Okay? For this contribution, collaboration, MLF make this contribution. Okay? Is it clear?
Yes.
I told you in the inferior part of the floor of the fourth ventricle, there are 2 triangles. Yeah?
Yes.
Hypoglossal triangle and vagal triangle. Under hypoglossal triangle, there is hypoglossal nucleus. This is hypoglossal nucleus for cranial nerve number 12. Hypoglossal nucleus. Lateral to the hypoglossal nucleus, here is dorsal nucleus of the vagus. Dorsal nucleus of the vagus. And lateral to the dorsal nucleus of the vagus, here there is solitarius nucleus. Solitarius nucleus. Okay, solitarius nucleus is a sensory nucleus for tasting. For tasting. Under olive on each side, there is inferior olivary complex. Inferior olivary complex is formed by inferior olivary nucleus. That inferior olivary nucleus is similar to a shrinkage bag. You see here, opening up this shrinkage bag is posteromedial. On the medial side of the inferior olivary nucleus, there is medial accessory olivary nucleus. And posterior to inferior olivary nucleus, there is dorsal accessory olivary nucleus. Inferior olivary nucleus, in addition to medial accessory olivary nucleus and dorsal accessory olivary nucleus, completely make inferior olivary complex. Inferior olivary complex. Inferior olivary complex receives impulses from cortex and basal nuclei and red nucleus and send impulses to the cerebellum. These fibers from inferior olivary nucleus to the cerebellum is called, these fibers is called olivocerebellar tract. Olivocerebellar tract. Olivocerebellar tract, after crossing in the medulla oblongata, ascends from inferior cerebellar peduncle. Okay? Ascends to the cerebellum via inferior cerebellar peduncle. Posterior to the inferior olivary complex and anterior to the solitarius nucleus and dorsal nucleus of the vagus, here, there is a nucleus that is called ambiguous. 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 Ambiguous is motor nucleus of the cranial nerves number 9, 10, and 11. If I ask you which nucleus is motor nucleus of the glossopharyngeal, vagus, and accessory nerves, you answer me?
Ambiguous.
Ambiguous. Is it clear?
Yes.
Okay?
Okay.
This section is from inferior part of the open part of the medulla oblongata. If I make a cross section from superior part of the open part of the medulla oblongata, all structures are similar, except dorsal nucleus of the vagus. Instead of dorsal nucleus of vagus, there is inferior salivatory nucleus. Dorsal nucleus of the vagus is parasympathetic efferent fibers of the vagus, and inferior salivatory nucleus is efferent parasympathetic fibers of the glossopharyngeal. Okay? Inferior salivatory is for glossopharyngeal. Okay? All structures are similar except dorsal nucleus of the vagus, that instead of dorsal nucleus of the vagus, there is inferior salivatory nucleus. Is it clear?
Yes.
Yeah? Okay. What's this section? Which part?
The first part.
Inferior part of the closed region of the medulla oblongata. You see here pyramidal decussation. Yeah? You see pyramidal decussation. And you see nucleus gracilis and nucleus conatus and spinal nucleus of the trigeminal nerve. All of them are small. You see here, you see here, corticospinal tract or pyramidal tract. Okay? I told you in the inferior part of the medulla oblongata, 75 to 80% of these fibers go to other side and make lateral corticospinal tract. This lateral corticospinal tract enter into the lateral funiculus of the spinal cord. And these 20 to 25% of fibers make anterior corticospinal tract without crossing in the medulla and enter into the anterior funiculus of the spinal cord. Yeah? You see here. Here is olive and inferior olivary nucleus. You see. What's this section? Where is this section? Superior part of the closed part. Yeah? You see here gracilis nucleus. Nucleus gracilis is large. Nucleus conatus is large. And here is spinal nucleus of the trigeminal nerve. Yeah? Spinal nucleus of the trigeminal nerve is here. These fibers are called internal arcuate fibers. These internal arcuate fibers on the opposite side make medial lemniscus. Medial lemniscus. Yeah? And in this section, we can see decussation of medial lemnisci. Decussation of medial lemnisci. In this section, in addition to medial lemniscus and internal arcuate fibers, we can see reticular formation nuclei, such as lateral reticular nucleus and medial or central reticular nuclei. What about this?
Superior section of open part.
This is open part. This structure is medial and motor or corticospinal tract pyramid. This is medial lemniscus. It's all medial lemniscus. Yeah?
Yes.
This is tectospinal tract, and here is MNF, medial longitudinal fasciculus. What about this? This nucleus. Hypoglossal nucleus. Motor nucleus of the cranial nerve number 12. Hypoglossal nucleus. And this nucleus is dorsal nucleus of the vagus. And this nucleus is solitarius nucleus. And here is ambiguous. Ambiguous. And here is inferior olivary complex. Inferior olivary complex. In the open part of the medulla oblongata, we can see hypoglossal nucleus, dorsal nucleus of the vagus, nucleus solitarius, yeah? Spinal nucleus of the trigeminal nerve, ambiguous nucleus, here is inferior olivary complex. This is medial vestibular nucleus, and here is lateral vestibular nucleus. Okay? On the floor of the fourth ventricle, you see this nuclei. What's this?
Corticospinal.
Corticospinal tract, motor. And this? Medial lemniscus. Yeah, medial lemniscus. You see here hypoglossal nucleus, and this is hypoglossal nerve that emerges from anterolateral sulcus of the medulla oblongata. And this nerve is vagus. Vagus has 4 nuclei. Vagus nerve has 4 nuclei. Motor nucleus of the vagus is ambiguous. Okay? Parasympathetic efferent nucleus is dorsal nucleus. A nucleus for taste,
Solitary.
for taste part of the
Solitary nerve.
parts of the epiglottis
Solitary.
is solitarius. And for general sense of the vagus, there is a spinal nucleus of the trigeminal nerve. Okay? These are 4 nuclei of the vagus. What's this?
Corticospinal.
Corticospinal or pyramid. And this? Medial
Medial
lemniscus. And this? Tectospinal
Tectospinal.
tract. And this?
MLF.
Medial longitudinal fasciculus. From anterior to posterior. N, ML, TS, MLF. N, MS, TL, M, ML, TS, MLF. Okay?
Okay.
Here is inferior olivary
Nucleus.
complex. From cortex, from basal nuclei, from red nucleus, the seed impulses, and there are reciprocal connection with the spinal cord and efferent fibers of the inferior olivary complex after crossing in the medulla oblongata goes to the cerebellum. Make olivocerebellar tract. Olivocerebellar tract. This is hypoglossal nucleus, and this nerve is hypoglossal nerve. Hypoglossal nerve has 1 nucleus, just motor nucleus. Okay? But vagus has 4 nuclei. Motor nucleus of the vagus is
Ambiguous.
ambiguous.
Dorsal vagus.
Efferent parasympathetic nerve nucleus is
Dorsal vagus.
dorsal nucleus of the vagus. A special sense for tasting is solitarius. And general sensory nucleus is spinal nucleus of the trigeminal nerve. Spinal nucleus of the trigeminal nerve. Okay?
Okay.
I will ask you about this nuclei. Vagus has 4 nuclei. Ambiguous, dorsal nucleus of the vagus,
Solitarius.
solitarius, and spinal nucleus of the trigeminal nerve. Okay? Glossopharyngeal nerve, cranial nerve number 9, has 4 nuclei, similar to the vagus. Motor nucleus of the glossopharyngeal is ambiguous. Parasympathetic efferent nucleus is inferior salivatory nucleus. Inferior salivatory nucleus. Sensory nucleus for posterior 1/3 of the time, for tasting of posterior 1/3 of the time is
Solitarius.
solitarius. And general sensory
Spinal
nucleus
nucleus of trigeminal
for
nerve.
posterior 1/3 of the time is spinal nucleus of the
trigeminal
trigeminal nerve. Vagus has 4 nuclei. Glossopharyngeal has 4 nuclei. How many nuclei are common between vagus and glossopharyngeal? 3. 3. Ambiguous,
Solitarius.
solitarius, and spinal nucleus of the trigeminal nerve. What's the difference between glossopharyngeal and vagus?
Salivatory nucleus.
In the glossopharyngeal there is inferior salivatory, and in the vagus there is
Dorsal
dorsal
vagus.
nucleus. Is it clear?
Yes.
Yeah? direction of the open part. Here is
Corticospinal.
corticospinal tract. This is ML, TS, MLL. This is nucleus of the hypoglossal nerve,
This is dorsal.
dorsal nucleus of the vagus in the inferior part, and inferior salivatory on the superior part. This is solitarius. This is ambiguous. Yeah.
Pyramidal.
This is pyramid. In this section, anterior to the pyramid, here, there is a nucleus that this nucleus is called arcuate nucleus. Arcuate nucleus. Difference of arcuate nucleus go to the lateral surface of the medulla oblongata and from inferior cerebellar peduncle go to the cerebellum. These fibers make external arcuate fibers. Okay? This is internal arcuate fibers and this is external arcuate fibers. Okay? In this section, in this area, some fibers of the arcuate nucleus go to the midline of the medulla oblongata and to the floor of the fourth ventricle. Okay? And go to the inferior cerebellar peduncle and to the cerebellum. These fibers are ectopic fibers of the arcuate nucleus because normal course of this difference is external arcuate fibers. These ectopic fibers on the floor of the fourth ventricle make stria medullaris. Okay? Stria medullaris that I tell you is between superior part and inferior part of the floor of the fourth ventricle. Okay? These are ectopic fibers of the arcuate nucleus. Is it clear?
Yes.
Okay. After this information about the medulla oblongata, can you tell me what's the problem of the first case I told you? First case that I tell you. I asked you about this case. 49-year-old woman experiences a sudden onset of headache with nausea and vertigo. She has difficulty keeping her balance and finds that she falls to the left. On examination, she has decreased muscle tone in the left upper and lower extremities. Muscle mass is normal. There is some intention tremor associated with movement of the left arm. Which part of the brain has damage? Which artery is most likely involved? And is this unilateral or bilateral? You told me this is unilateral.
Yes.
But this unilateral is on the left side or right side?
Must be on the left side.
Left.
Left.
On the left side, yeah. On the left side. Why?
She's fine
left
to
side
fall
is
on the left.
controlled by the Bayesian ingress from the left side.
What?
Should be on the right side.
No, it's on the
No, on the left side is correct. Which part of the brain? Medulla oblongata.
Yeah.
Medulla oblongata. Which artery? Posterior inferior cerebellar artery is a branch of the vertebral artery. Two vertebral arteries attach together and make basilar artery. Okay? When posterior inferior cerebellar artery on the one side make damage, you can see internal medullary syndrome or Wallenberg syndrome. Wallenberg syndrome. This is response of the
Questions?
answer of the question. Occlusion of the left posterior inferior cerebellar artery. Posterior inferior cerebellar artery is a branch of the vertebral artery. Results in lateral medullary or Wallenberg syndrome. Damages structures include the spinothalamic tract. Spinothalamic tract. Loss of pain and temperature. Spinothalamic tract, loss of pain and temperature on contralateral body. Why contralateral? Because corticospinal tract has crossing in the spinal cord. Yeah?
Yes.
When on the left side there is a damage on the spinothalamic tract, opposite side has loss of pain and temperature. Okay? Spinal nucleus of the trigeminal nucleus. Spinal nucleus of the trigeminal nucleus is here. Okay? Loss of pain and temperature on ipsilateral face and descending sympathetic fibers, ipsilateral Horner syndrome. In the Horner syndrome, there are many signs and symptoms. Ptosis, enophthalmos, and meiosis. Meiosis means contraction of the pupil. Contraction of the pupil on one side. Ptosis means falling the eyelid. Okay? And enophthalmos means go back the eyeball. Okay? Going back the eyeball and make decrease in the eye appearance. Okay? Nausea and vertigo and limb ataxia, intention tremor I told, result from damage of the cerebellum. Damage of the cerebellum. In the inferior cerebellar, peduncle and vestibular nuclei. Then I tell you, she's falling
To
to
the
the
left.
left side. Okay? It shows vestibular nuclei on the left side are damaged. Is it clear?
Yes.
Here we have internal, no.
Yes.
You have
وش هو حسنين؟
سويته؟ ايه يلا شكرا.
Doctor, these symptoms, can they be caused by a stroke? Can they be caused by a stroke?
Don't have? You see how? You have? That class